project is focused on developing a framework for improving surgical cardiac care for children in low and lower middle income countries. And I'm just going to present our study methods and some of the early results in the last couple months. Cardiac care. So the research question is really, what are the unique challenges to scaling pediatric cardiac surgery in different LMICs? And the rationale for this was, generally there's an increased incidence of children requiring cardiac surgery in LMICs. And there are a couple of factors to this. There's just a prevalence-wise, there's an increased youth population in some of these areas. Preventable diseases that aren't prevalent in industrial countries, like strep infections, for example, can lead to things like rheumatic heart disease. And then the pediatric mortality hasn't really improved significantly. So in LMICs, typically there's been a larger focus for communicable diseases, which means conditions like congenital heart disease or acquired heart disease have been somewhat overlooked. There's also resource issues and arguments, for example, if the large amount of money that could be spent on complex surgery could be better utilized for other more common pathologies. And then largely pediatric cardiac surgery has been an afterthought to scaling adult cardiac surgery. So a little bit of background on global cardiac surgery before and now. And this is just a perspective that was published by James Cox, who's one of, I guess, the leaders in the field. And this is about 2 decades ago. And he wrote this perspective talking about how more attention should be given to global cardiac surgery. And this paper cited this figure, which shows the number of cardiac surgeries per million in different areas across the world. And they cited approximately 900 would be a safe amount per million based on prevalence. And you can see places like North America, Australia, Europe hover around that area. But places like Africa, 20 years ago, there was only 18 surgeries being performed per million. And most of these surgeries were through humanitarian surgical initiatives. So surgeons from these developed nations who are traveling for maybe a week and a year just to perform a couple surgeries. Now, 2 decades into the future, there has been some improvement. So in addition to these humanitarian efforts, there are things that have additional focus, like education, training. There are some self-sustaining centers of excellence. So this is an example of a center in Sudan that was founded by an Italian NGO, and they perform cardiac surgery for mostly children who have things like rheumatic heart disease, free of charge, and it's funded partially through the government, privately as well, and through this NGO. But despite that, children generally in LMICs haven't really improved with regards to their mortality. So since 1990, if you look at mortality for children from congenital heart disease in LMICs, this has only declined by about 6%. But if you look at high and middle income countries, this has declined by more than 50%. So there has been some effort into the expansion of cardiac surgery in the global setting. And this is a chart that was used, I believe, for scaling just general surgery, anesthetics, and it was applied to the cardiac setting. And it talks about just different avenues that need to be focused on when it comes to scaling. So things like infrastructure, workforce, financing. But the question is really, are there any unique challenges with respect to pediatrics? So for example, late congenital heart disease presentations, how can those be managed? Pre and post-operative malnutrition and how that ties in with survival after surgery, things like further education and training that's required for pediatric cardiac surgery, resources, governmental priority. These are just some examples. So the aims, there's 2 aims. The first aim is really the scoping review, which is to identify preliminary criteria for capacity building in pediatric cardiac surgery. So to do this, we are scoping literature for all instances of scaling pediatric cardiac surgery, and learning from what challenges are present and what solutions are being currently implemented, and then comparing these with existing capacity building frameworks. The next step after this would be to take these preliminary criteria that we have found from the literature and see if it resonates with what the providers experience in the LMICs. So conducting sort of a modified Delphi panel, speaking with these surgeons and residents in the LMICs or fellows, and seeing if the criteria that we have found in the literature for capacity building resonates with what they experience, and then finally consensus on a final list of criteria, likely through some sort of survey. So for the AIM-1, which is what we're in right now, we searched across 7 databases, and after removing duplicates, we found 8,476 papers, and this was largely through search terms that focus on LMICs, pediatrics, and cardiac surgery. We had 2 independent reviewers, myself and another student, screened title and abstracts of these 8,476 independently, and then come to a consensus on about 396 articles that should undergo full text review. And this is where we're at right now. So I'm completing full text review using NVivo, where I can kind of look through the papers, determine whether they fit our inclusion/exclusion criteria, as well as code into different themes that emerge. And see, these are some of the preliminary themes that we found so far. Some general challenges like accessibility, availability, awareness, cost, education and training, and so some solutions that papers have brought up so far, as well as kind of putting them into geographical spaces as well, from where these where the literature is coming from. The end goal is to potentially have a framework that kind of looks something like this, where you have these different environments that are at different stages in capacity building and have different resources and challenges, and kind of guiding on where attention should be given and what attention should be given. So for example, whether it be education, funding, patient awareness, things like that. And then taking this framework and speaking with and surveying those who work in these areas to see what their impression is of it. And that's it. If anyone has any questions, I'll be happy to answer.